know it's a bit different from Italy. In Italy, even like aesthetic doctors, general practitioner, they can inject hyaluronic acid in the body and in the buttocks. So any one of you, like plastic surgeon or dermatologist, general physician? Okay, this is very important to me. Why? Because buttock augmentation, and you see it in my second slide, although it's in Italian, is, I'm not a marketer, but in my experience, is one of the requests that it's growing faster. Due probably to social medias and all these Kim Kardashian things. The trend is changing, but treatment of the buttocks has become one of the biggest increase in my practice in the past 4 to 5 years. And this is why I researched also, and it's not just me, I wasn't the luckiest one, but it's growing. And according to ISAPS, the International Society of Plastic Surgeons, the demand for buttock treatment is going to go up and up, even more than breast augmentation in terms of percentage. So I know it's funny and stupid, but I call this treatment the breast of the back. And it is very important for you guys because you can really substitute surgery. This is one topic. Aesthetic medicine can be a substitute of surgery. Me, myself, as plastic surgeon, I don't do buttock augmentation with implants. I don't know too much about it. I don't like it. And the only patient I've met were requesting removal of the implants rather than placing the implants, and I'll tell you why. So it is of extremely important that you know that you can give great results, more natural, and with less downtime, and that's very important. Buttock augmentation in terms of implants, it's very painful, especially in the first days. The patient cannot even walk. They have to lay on their belly. It's annoying. So anytime a patient comes asking for implants, 90% of the time with my arguments, I can avoid and turn it into a outgoing patient for aesthetic medicine. As a plastic surgeon, yesterday, for example, I explained my idea about facial rejuvenation, and there is nothing that can substitute surgery in that area. So you cannot lift tissues without a proper facelift. Here in buttocks augmentation and in the body, you can, and by the fact that every one of us knows that the implant of hyaluronic acid becomes stable by time, the results will be stable by time, and you keep adding just a little by little. So the question you made, I'm from Napoli. Napoli has one of the most important museums for antiques, Roman and Greeks. And this is Venus Aphrodite called Callipyge, that means of a beautiful buttock. Beautiful buttock, so it is of extreme importance even from back to the days. One of the reasons is like ethnicity and sociology, probably also linked to our animal nature. Because when mating animals, they don't mate fronting each other. They mate from the back, right? So human beings at the beginning, they were not seeing breast, they were seeing the buttock. So in our brain, what? The man, not the man. But, women and, patients, they are doing things for them, but also these days, they're doing things to appear. Just remind this. Of course, ethically, you shouldn't think about it, but in my opinion, although I criticize a lot the use of social medias, the social medias are basically changing our habits, are changing our history as aesthetic practitioner, because the demand is so increased, because everyone is looking at a model they want to look, they want to be kind of. So, and one other thing was, we name a lot of things, at least in Italian, in my language, after Venus. So there is Venus strabism, there is Venus color, and there are also Venus dimples. So you can imagine how many things are linked both to Venus and both to buttocks. This is in Italian, I'm sorry, but you can see how the trend is growing. And there is an estimation, the surveys of ISAPs, they come out every year. I haven't seen the 2025, but the estimation is from 2022, 820,000 to almost 1 million, okay? It means there is a huge market. And not only there is a huge market, but the aesthetic doctors who are actually into this field, into this topic, are very few. So if you are coming out as doctors treating buttocks, you will have a big market only for yourself. Sorry? Second of all, besides, and I will tell you later, besides few risks and few risky area, the buttocks are quite, now I don't want to say easy because nothing is easy, but it's relaxed. It's something that's very, very rewarding for the patient, and it gives you like the feeling that you're doing something relatively safe, and you can go back home sleeping without any harm, and that's very important. Second, because you're treating an area that it's concealed. So even if you have like hematomas, bruising, the patient is not going to care because she's covered up. Whereas, I mean, at least in my experience in southern Italy, no one wants to show any sign of having done anything on their face. So even if it's a little bruising, it's a tragedy. As I was telling you, to me, and also from what I've read, there are no particular rules for a beautiful buttock. It depends on the ethnicity, and we all know that in Southeast Asia, in Asia, the taste for a beautiful buttocks is different than from European or African. So there is rule we may share or not, that is the 0.7 ratio. The 0.7 ratio between the waistline and the hips. So the ratio, the ratio between waistline, sorry, I do all the time. The ratio between waistline and the hips, if it's 0.7, it means like you have like a clock work figure, and the Caucasian taste, usually the Western taste, tends to be like that. African taste, for example, prefers a more projected buttock. Asian taste, no, they want both waistline and hips to be almost on the same line. So this ratio is different. But mainly what I do see is Caucasian patient. So the taste is more like the first one. If you remember a few years ago when Kim Kardashian showed that she had like hips very like quite large, and the what? prominent, and with the waistline, with a very narrow waistline, the request was for, augmenting the hips even more than the buttock itself. So it was like, I want to look like Kim Kardashian. Nowadays, after a few years, everything is going a little more natural. In order to assess a buttock, what I do, and what it's like preferable, is to analyze both frontal, posterior profile, and infragluteal fold. Into the frontal view, as I told you before, the waist to hips ratio should be 0.5. This wasn't me, of course. The first study was from Wong, and this defined an attractive waistline and hips ratio. I don't believe that this ratio is the same for everyone. Everyone is different, and everyone has a different request. So you should respect that. In the profile view, the most important thing, and this is what actually I am asked more than the ratio, is projection. Okay? The apex is the point of maximum projection of the gluteal area, and ideally it connects the end of the abdominal curve and the beginning of the tight profile. While assessing, we have to decide whether we want to put the apex on this line, or we want to use another line, depending, and you will see it later, whether the tissue, the soft tissues, is above this line or it's underneath this line.
So the line that you design is on...
It's a standard.
It passed directly on the femoral head.
Almost, yes.
Not on the trochanteric...
No, more onto the femoral head. But basically, it connects the abdominal curve to the beginning of the tight profile. But this is just standardizing. I don't like to standardize, and you see it later, because even if the apex is here, it doesn't mean that I have to place my apex here anyways. From the posterior view, there are different shapes or different figures that have been described. Usually it's four shapes. We, as doctors, probably as human beings, we need to create a scheme of, shapes, treatments, or whatsoever. This is just to give you the idea of what a shape is for the body, so that you will have like some references to use when you want to treat the buttocks. The O shape, or if you like, fruit, or it's like apple shape, has an even distribution of soft tissues all around. There is low or zero grade of trochanteric hollowness, and the apex is central. So this is more or less what I call a buttocks that has a round shape. As you can see, but here, where there is a little hollowness, the shape is round. There is almost no hollowness on the side. The trochanteric hollowness is what my patient asks to treat more than anything else, because trochanteric hollowness gives a male appearance to the buttocks rather than a female appearance. So this is what I treat first, rather than just volumizing. The apex is central, and there is no lack of volume. The fold is like horizontal, and it's like 2/3 of the length of the leg. This one here is what it's called A shape, because it looks like an A. Sometimes if you're feeling romantic, tomorrow is St. Valentine, you can call it heart shape. And I don't know, no, we were talking yesterday, and we were discussing about tomorrow is St. Valentine, and probably for male the best gift for the ladies is to give buttock augmentation tomorrow. But anyhow, the shape in this case is still good looking, but part of the soft tissues is underneath the apex. Okay, so you have slight downwards appearance of these buttocks. In this case, and we will discuss it later, we cannot place the hyaluronic acid or whatsoever right onto the apex. Otherwise, the risk is that the pressure and the weight of the hyaluronic acid may imply that the soft tissues underneath the apex would look even more, okay? So there is more tissue below the apex, and there is some grade of trochanteric hollowness. This is the most difficult case, and this is what actually comes to my practice most of the time. We all know that we cannot treat this buttock only by adding volume. If we add volume, in this case, we're not achieving good results. So what I'm telling my patient, if they want to use just injection, they don't want to go for liposuction or lipostructure, we're gonna have to use some other treatment for the skin itself, and then we may add volumes, or we can try to get rid of the adipose tissues here on the side. There is the trochanteric hollowness, you can see, and the soft tissues is way under the apex. You see multiple folds, the intragluteal folds. And the last one is the inverted V. So in this case, for example, I don't recommend to treat when it's inverted V, because this case has more tissue over the gluteal area and less here. So if you don't get rid of all the fat above, you will never get any good result. Male tissue, male buttocks is like that. It's more like an inverted V. So if it happens for you, I never treat man. It happened to me just one. But when you treat in man, you should respect the fact that the buttock of a man must look like an inverted V. So respect that here, the appearance of the trochanteric hollowness must stay, and they all have fat only onto the intragluteal fold and onto the hips. Whereas for female, you can see that the fat is evenly distributed all around.
But how can I know it's V? Because like just you put V and I see.
You can see
In
it.
my patient, I can't.
What?
In my patient, if I see, I will not recognize this is V. How you can know it's V? Just short explanation.
I don't get the question.
How can I know this is V if I know if I try to do that for the patient? So
He asks how to diagnose
yeah,
the
how to
shape.
diagnose.
Oh, it's easy, because the V shape has more tissue onto the hips, right? Rather than onto the buttock itself. It's like this, right? So if you don't, the options are you either use a huge number of vials to enlarge the buttocks, but this is not what my patient wants. On the other hand, you should tell your patient that she is not candidate for buttock augmentation at this point, but they should go with treatment of this area first, Okay? So when the hips are way too much fatty, they need to understand that they have to get rid of the fat before treating the gluteal area. That's very important. The infragluteal fold, it's another landmark. It increases its length and its heaviness with years. Of course, you can see how in this young patient, the infragluteal fold is almost invisible. She is in her 20s. This patient is in almost her 30s, and you can see that it goes all the way half to the length of the leg, or 2/3. After menopause, most of the time, the patient, their adipose tissues is hypertrophic, so it tends to go down, and the infragluteal fold goes all the way to the length of the leg. As I was telling you, the treatment of the buttocks, it's quite straightforward if you have in mind what you want to do, if you have in mind what is the shape. If you are beginning with simple shapes like O shapes or heart shapes, it's very easy. You don't need to use that many vials. And the anatomy itself, it's quite straightforward and it's safe. The only thing you have to avoid is injecting into the gluteal muscle. It may seem really straightforward, and you can think, how easy it can be to pierce through the muscle. It's very easy, especially in those kind of patients where the tissues are kind of atrophic, and even the muscle doesn't really hold that much. So it's very easy, especially because for me, and you will see it in the practical part, I inject also anesthetics. So the patient is very relaxed, doesn't feel any pain, so you can do that. So power is nothing without control. So the anatomy of the buttocks, at least of some areas, is very important. The anatomy of the layers, it's quite simple. We do have skin and superficial fat. Then there is the superficial fascia and the deep fat. Most of the time, we inject here. Okay? You don't want to go down the deep fascia because the deep fascia is in contact with the gluteus maximum muscle. And if you're going through the fascia, you're going into the muscle. Two horrible risk. Hematomas, it tends to get infected quite easily, and risk of embolism. Now, in my research, there is no case of embolism into the buttocks for hyaluronic acid, luckily. But you all know that at the beginning of the 2020s, 2022, this request for Brazilian back to lift, it brought to a death ratio in the United States of 1/500. Okay, it meant that it was a huge number of casualties because of an aesthetic treatment, aesthetic surgery. But that was why colleagues back then were using muscle as a recipient site for the fat, because they were thinking, and actually it's kind of true, that the fat grafting will survive better than just placing it over the muscle. But on the other hand, there was a huge number of casualties because the gluteal vein, when you break it, when you go through, it acts like a vacuum. So it aspirates all the fat, and the fat causes thromboembolism. So it is very important to me to respect two things: a maximum number of vials. I am not a fan of injecting that many vials. It makes no sense at all. Okay? You can go up to 7, probably. 7 is like by side. is the greatest number, the biggest number I've used in the same session. When I have seen many patients treated somewhere else with a lot of vials, like 15 per side. Now, in my place, they know that I am kind of expert into buttocks augmentation, not surgical. So I see a lot of complication from other colleagues. And when a large number of vials has been used, some patients, they even have impaired walking. They cannot walk for like 10 meters. They have to stop because it hurts, okay? So what it's kind of smart, at least it sounds smart to me. You want to use 15 vials, okay, you divide it. Like one session, you tell your patient in 3 months you come, and probably you're not even going to need 7 vials again. You're going to need less, and you're spending less than you were expecting. The patient will appreciate, and you'll be on the safe side.
7 for the entire?
No. 7 by side. Yeah, 7 by side. Yeah. But that's maximum. Because if you place it correctly, 5 is more than enough. Then the patient comes in. If she's not happy, you add a little more. Okay? The selection of the patient is the most crucial thing into the success of the treatment itself. Because if you're treating, as I was telling you, if you're treating a patient that has already tissues but above, or the tissue is atrophic, you can place 200 vials. You're getting in huge complication, and you're not going to end up with good results, okay? So the gluteal area, we all know that it's comprised between the iliac crest, intergluteal cleft, and the gluteal fold. There are some variables that cannot be changed, like the bony pelvis. You cannot change the shape of the bones. The muscle, both superficial and deep, the muscles are used in surgery because you create, as the breast, a pocket in where to put the implant. What we can work on as aesthetic doctors is both fat and skin. In fat, for the fat, we can replace fat with hyaluronic acid. About the skin, this is not the topic, but I want to tell you guys, because here I'm here to teach about hyaluronic acid, but also to share my experience. I use polylactic acid. So one thing, and I'll tell you later, if you assess that the tissue itself it's kind of atrophic, don't start with hyaluronic acid, but try to improve the quality of the skin first. This is just the layers we were talking about, the bony framework, the gluteal frame shape, the depression of the lateral trochanteric area. This is something I always start from, okay? If there is trochanteric hollowness, I always start from the trochanteric hollowness rather than just giving projection, okay? Because it's going to change the appearance of the whole frame, and then afterwards you can work on the projection. The 4 junction point is you have to assess this area here. This is the most important thing when working on buttocks. It's the gluteal danger zone, and is a triangle that was described by Villanova and his other colleagues, and it's located between the iliac spine, the superior iliac spine, the great trochanteric, and the ischial tuberosity. So it's basically here, okay? In this area, you have to pay attention, because if you go deep, you will find the gluteal arteries and gluteal veins. So always be careful. Avoid injecting too deep to the fascia, into the muscles, because these vessels are kind of, especially the veins, are very prone to rupture, and you can cause big hematomas. I've seen cases of hematomas. They will resolve by itself, but for a week or so, the patient is going to be in pain, like cannot walk. Now, the criteria of patient inclusion into this treatment, first, you want to assess skin and soft tissues. There can be ptosis, but it must be both to mild or zero. If there is a big ptosis, so it means that the volume, as we saw, is more here, treating these buttocks will be quite tricky. The BMI is between no more than 18 to 30. You're going to have big satisfaction if you're treating round shape, A shape, or H shape. This was more like a bit squared, and it was the image I showed you before. So from a H shape, from a square face, you can turn it round. And this result is stable after a year. The patient haven't had any injection, and you can see she's standing. This was taken in the winter. This was taken in the after the summer. And this is basically what my patient requests, okay? A natural appearance of a round buttock. This patient here, she is quite tricky because she's a personal trainer. The skin, you can see, is very, very, very thin. There is basically no adipose tissue, especially here. So you want to pay attention. You want to use a product that is also able to act like fat. Because if you're using stronger product, there are in the market stronger products, you are basically creating lumps, and it's going to show. The first request was, I want to do something, but pay attention, it has not to be visible because I am on social medias, and if my clients understand that I've done something, they will discard me as a personal trainer because I'm the one telling them they should exercise rather than go into a plastic surgeon. Yeah, this is what happened. So she already had a good-looking buttock. We only have to enhance the shape, and I was able to do it with few vials. I think I did 3 vials on this side and 4 vials on the other side because there was a symmetry here. There is, the reason why there is a symmetry and the reason why she came to my practice is because some genius, I have to tell this, decided to withdraw. She had breast augmentation, not with me, but she needed fat to correct some asymmetries, and they decided to take fat out of the buttock. Please never do that. So you can see now, not only the trochanteric hollowness is improved, but also the overall shape looks higher. Why? Because I placed, you can tell, if this is the apex, the soft tissues is here. So what I do is to place the implant slightly above the apex. In this case, the hyaluronic acid can lift the soft tissues and is going to give you a lifted appearance of the whole buttock. Other view. Another patient. Now, this is quite tricky also because the shape it's a bit squared and the soft tissues are here. and you can tell it from the intragluteal fold, right? So after injecting, you can see that the shape is round, and the infragluteal fold is improving a lot, almost disappears. What did I do? Again, if the tissue is here, you don't want to put anything here, otherwise you're going to enhance the lower pulse. So we are just injecting the trochanteric hollowness and the upper pulse. And it's only like 4 vials per site, nothing more. Most of the time, I am lucky because the request, it's kind of funny, the request for buttocks augmentation comes from patients that already have a nice buttock. And also, I discard like patients that are not suitable for these kind of things. 2 reasons. One is because I know I'm not going to get any result. Second, the patient is not going to be happy, and she's going to give me headache for my entire day or for months. So it's better, if you're not sure, better to discard the patient. Tell her to go to a plastic surgeon, tell her to go to the spa, tell her to get a lover, but not buttock augmentation. So you can tell by this picture that the product wasn't placed here, right? Here, it's the same. The projection is higher than the apex. The apex is here, and I place my product up here. And this is the one we saw, one of the most difficult cases. In this case, I tell you, I have used, before treating, polylactic acid. I've used polylactic acid in order to improve the appearance of the cellulitis first. The tissue then gets more elastic, and after 2 sessions of polylactic acid, it means, so it's like 6 months, then I can decide if I want to add some hyaluronic acid on the side or onto the apex. So although this is not the day we are talking about polylactic acid, but just keep in mind that as aesthetic doctors, we have a lot of products, a lot of weapons in our hands, okay? So it's not just about hyaluronic acid. Some other doctors, they only use polylactic acid. You know why? I don't know why there is this sort of religion. There is a split between the colleagues using hyaluronic acid, the colleagues using PLA. The thing is, the more you mix the techniques, the better result you can achieve. So this is the 3/4 view. And this is all the time, every single time. Even if I'm injecting 1 vial, I always dress my patient for 2 main reasons. One is to keep it as clean as possible, avoid any kind of infection. And second, because with the dressing, I'm able to keep for the first day or second the hyaluronic acid in place. Third, because most of the time, and I'll show you later, when I'm using the cannula, I undermine the tissue as I was doing a liposuction. So when you undermine skin and subcutaneous tissues, you need to put some dressing, because this way the skin itself and the soft tissues will heal higher and will shrink. But then you're going to have to be dressed, otherwise there's going to be some swelling, and you don't want that. Exclusion. Okay, this kind of patient you want to exclude. This patient has not such a huge grade of ptosis, but she is V-shaped, and also, especially, she has a story of weight loss. When it comes to a story of huge weight loss, she lost like 30 kilos, Okay? She is a patient of mine. I operated on her both abdominoplasty and breast, and she wanted to improve the gluteal area. I couldn't just use hyaluronic acid. In this case, for example, you cannot imagine how many doctors would go for implants. You know what happens? It's just like the breast. If the tissue is sagging, it will sag over the implants, and you will have a waterfall effect of the buttocks. And then you know what they do? They call me up and you say, oh, you know, can you please improve this result by using either polylactic acid or hyaluronic acid? So, and this is what happened after a year of treatment. You can tell this is what with just collagen stimulator with polylactic acid and just a little bit of hyaluronic acid. And you can tell she has tan also. So this was at the beginning, and after almost 9 months, she ended up like that. And you can tell how the intragluteal fold, even though, I'm sorry, the lights are different, but you can tell how the intragluteal fold has improved, and also this area here, where she had almost nothing, just skin sagging. But keep it in mind that this kind of patient is not suitable for hyaluronic acid from the beginning. Then, what is it? Are we exploding? Like, is that a bomb?
Not yet, not yet.
Not yet. No, I'm calm. I'm very... So, in this case, for example, I can predict that the results won't be... I can use anything. I can use hundreds of vials, but the patient is skinny, the skin quality is not good. I've used both. I started with hyaluronic acid, then I turned to polylactic, and then hyaluronic acid again. Yes, well, what we say in Italy is poor result is better than nothing, but still, I wouldn't consider this to be a great result. This is how I do my drawing, but then I will show you later. I press onto the buttocks, sign the limit of the gluteal area. Then I check the center. This is a patient, she's modeling because she already has a beautiful buttock and doesn't need anything. But then the drawings, I'll show you later. I try to make the center, and then from then I will show you later the design. Now, to go back to the patient I did before, we were discussing about the V-shape. This patient needs lipostructure, doesn't need anything else. Just to make you aware, when you have to discard patient, and if you're not surgeon, you send them to a surgeon, then they will be happier. I don't know if the thing's going to start. No. What? Oops. What? Can I? How do I go back? I don't know if the video is starting or not. But we're done. I just wanted to show you the final result. Barak, there is the last video that it's not working. I mean, it's not so important, but yeah. Can you go to the last slide? Yes.
This one?
Yeah, that one is a video. I don't know. Yeah. Yeah, it's working, I think. Is it working now? Yeah. So that's the drawing for the lipostructuring, and this is how she looks like nowadays. Okay, that's it for the most annoying part, the theoretical part. Thank you.